Alcohol-related violence. All highlighted research and studies within this document, unless otherwise stated, are extracted from the US National Institute on Alcohol Abuse and Alcoholism. Their research on violence has consistently linked alcohol consumption and violence. A strong link exists between the quantity of alcohol consumed and the frequency of a wide variety of violent acts, including sexual assault, child abuse, and homicide. Studies of aggressive behaviour. Laboratory studies can provide a direct measurement of the association between alcohol and aggression. An unknowing participant is paired against a fictitious opponent with both allegedly performing a task. To win the task, the participant can subject the opponents to actions that most people would consider excessive, such as taking money or inflicting pain on the opponent, such as an electric shock. The quantity or intensity of the act inflicted on the opponent then becomes a clear measure of the participant's aggression. Studies have validated this approach in differentiating between violent and non-violent people, with criminals convicted of violent crimes clearly demonstrating more aggressive behaviours than criminals convicted of non-violent crimes. Investigations using a variety of laboratory measures of aggression have demonstrated that the consumption of alcoholic drinks resulted in greater aggressive behaviour among the participants than those who were not alcoholic. However, not all study participants showed increased aggression after drinking alcohol. This variability likely results from individual personality traits that influence a person's predisposition to aggressive behaviour, such as the presence of antisocial personality disorder, both with and without alcohol. For example, people with histories of behaviours associated with APD were generally more aggressive than those without the illness. Several laboratory studies have supported the idea that the level of alcohol-related aggression is related to whether a person has a history of past aggressive behaviour. US studies have shown that students with higher self-reported hostility demonstrated more rapid increases in aggression in response to provocation after alcohol consumption than did students with lower self-reported hostility. People with APD, many of whom have particularly strong aggressive tendencies, are especially prone to alcohol-related aggression. So people who are more likely to be aggressive without alcohol are also more likely to be aggressive with alcohol. When combined with the effects that alcohol has on impairing judgment, this becomes a dangerous combination. Studies on the association between aggression, personality characteristics, and alcohol consumption allow three main conclusions as follows. 1. As a group, people with APD are more aggressive than people without APD, although not all people with APD show increased aggressive behaviour. 2. The best predictor of aggressive behaviour appears to be the amount of aggressive behaviour a person has demonstrated previously. 3. People who are more likely to be aggressive when sober are more likely to exhibit increased aggressive behaviour when under the influence of alcohol. Impact of alcohol abuse in Australia. The effects of alcohol-related issues in Australia, particularly among young people, is an area of growing concern. There is a well-established drinking culture in Australia whereby the consumption of alcohol, frequently at excessive and harmful levels, is associated with many forms of activities. There is a strong link between individual and social damage and alcohol abuse. The consumption of alcohol is a significant risk factor for violence. The total cost attributable to alcohol-related crime in Australia now runs into billions of dollars. National surveys of alcohol use and victimization provide further evidence of the impact of alcohol-related violence. According to the National Drug Strategy Household Survey in 2007, approximately 1 in 4 Australians were a victim of alcohol-related verbal abuse, 13% were made to feel fearful by someone under the influence of alcohol, 4.5% of Australians aged 14 years or older had been physically abused by someone under the influence of alcohol. The rates of physical and verbal abuse by a person affected by alcohol were more than twice the rate of other drugs. In addition, more than 1/3 of victims, 38%, had consumed alcohol themselves at the time of the incident. This is consistent with evidence that shows that a significant proportion of violent offences are committed by and against people who have been drinking alcohol. Australian research estimates that a significant proportion of assaults involve alcohol. In a New South Wales study, 2/3 of patients presenting at an emergency department with violence-related injuries reported having consumed alcohol prior to the incident. Characteristics of alcohol-related violence. Evidence from Australian and overseas studies has explored the association between alcohol and violence and identified a range of areas that can be targeted. Factors that have been identified as important predictors of alcohol-related violence include a mixture of individual and situational factors. Key findings relating to the characteristics of alcohol-related violence include: young, single males are the most likely to be involved in alcohol-related victimization. Place of incident is more likely to be pubs and clubs for males and in their own home for females. Rates of self-reported victimization are particularly high among young people living in rural areas. A significant percentage of perpetrators of alcohol-related issues are also victims. Young people tend to demonstrate behaviours of binge drinking, which leads to high rates of alcohol-related issues. Female victims are likely to know their male attacker. Alcohol abuse increases the risk of sexual assault as victims become less able to detect dangerous situations. Alcohol is involved in a significant number of homicides. Alcohol-related violence in Indigenous communities. While the proportion of Indigenous people who consume alcohol is lower than the rest of the population, those who do consume alcohol do so at far more harmful levels. As a result, the excessive consumption of alcohol and alcohol-related violence continue to be a significant problem within Indigenous communities. Victimization or physical abuse by someone under the influence of alcohol has been shown to be much higher among Indigenous Australians. Alcohol and family violence. Alcohol is also an important risk factor for both domestic violence and child abuse and neglect. Alcohol involvement in intimate partner homicide is very high. The consumption of alcohol, either by the offender or victim or both, is a significant contributing factor in incidents of non-fatal domestic violence, with research demonstrating that women whose partners consume alcohol at excessive levels are more likely to experience domestic violence. Research has shown that the excessive consumption or misuse of alcohol is associated with poor quality parenting, which can lead to child experiencing a range of physical, emotional, or psychological problems. Victims of child abuse, particularly physical abuse, and neglect are more likely to offend themselves later in life.